Health, your weekly holistic prescription for living healthy naturally. Well, our bodies are wired to send us signals when something just isn't right, but often we're too busy to hear them. Compounding the problem is quite often a lack of understanding about the future consequences beyond weight gain if these symptoms are left unaddressed. Without hormonal balance, we can't achieve ideal weight and are subject to disease and illness. Joining us today to outline a plan to balance your diet and your environment is Dr. Natasha Turner, naturopathic doctor and author of the best-selling book, The Hormone Diet. Welcome back to the show.
Thanks very much for having me.
Oh, it's my pleasure. Look, we should have had you even earlier. It was last year already. I couldn't believe it, last summer sometime. The Hormone Diet. Lose fat, gain strength, live life younger and longer. Great book. Lots of information. We could never get through it in one show. No. But let's start by suggesting, there's a lot of people out there really making their best effort to lose weight. They really are. Sometimes they don't know. They're doing the right thing for the wrong reasons, the wrong thing for the right reasons, perhaps. What are they doing wrong?
Well, unfortunately, most of us are not at all thinking about our hormones when we're trying to lose weight. And if you really understand the process of weight loss, it's all about your hormones. They're actually dictating every single aspect of your ability to lose weight. So if you know that, then if you have any signs or symptoms of hormonal imbalance, you actually have difficulty losing weight. And unfortunately, if you're in that situation, which was my case, I wasn't losing weight regardless.
There's a little bit of a personal story behind this for yourself in particular, right?
Yes, that's right. I found out I had a deficiency of thyroid hormone. I think we're going to talk about that a lot tonight, but it has to do with every aspect of your metabolism. So I was dieting, I was watching what I was eating, I was exercising, and yet I failed to lose weight. And in fact, I just continued to gain and gain and gain. But I'm very frustrating. I gained about 25 pounds. But the problem was that I actually chose to do things that just perpetuated the problem. I started to restrict my calories more and more because I thought, okay, I'm obviously eating too much. I started to exercise more, and I started to do the wrong type of exercise. I started to run. And those two things, cutting my calories and running more, actually increased the stress on my body, slowed my metabolism, and actually dropped my thyroid hormone, which was already deficient, even lower. And it wasn't until I bottomed out and I finally got put on a prescription to restore my thyroid hormone, and I started to completely change everything that I did. And unfortunately, that's what most of us do. We really restrict our calories, and in fact, you need to eat more more often.
Yeah, it's not that easy, right? There's no template plan. In fact, I know as a naturopath, you often, quite rightly tout individualization is key, really understanding each case by case. But let's just ask this question off the top. Is there one hormone, you mentioned thyroid, and that was your issue.
Right.
Is there one hormone, in this case thyroid hormone, more important than another when we're talking weight loss?
The aspect of the hormone diet is really that you have to balance all your hormones. So I think any one symptom of hormonal imbalance will negatively impact your ability to lose weight. But the problem is that the majority of us, I think if you put 10 people in a room, 9 out of 10 people would have hormonal imbalance and they wouldn't even realize. And so one of the things that I do is I help people understand their hormones, what they are, and how they influence their health. And so there's a questionnaire where you can answer the questions, am I in balance? And there's 16 different groups of questions, and that's 16 different hormones that have to do with your ability to lose weight, whether it boosts your metabolism, affects your appetite, affects where your body stores fat. But really, I think the most important thing that we have to understand is insulin. Insulin is really, theoretically, the only hormone that instructs your body to store energy as fat. And unfortunately, the majority of us are walking around with high insulin levels all the time.
We're not treating our, we're not treating our bodies right with these refined carbohydrates, sugars,
and
our pancreases are overworked,
That's right?
But not about, a lot of us have this pre-metabolic syndrome going on, right?
Yeah,
pre-diabetes, it's an epidemic.
By the time we're 35, I think 1 in 4 of us have a risk factor for insulin resistance or pre-diabetes, and by the time we're 65, it's something like 3 out of 4 people. And so if you have high blood pressure, if you have low good cholesterol, if you have borderline blood sugar, if you have fatty liver, if you have increased weight around your abdomen, I think it's a very good indication that you have high levels of insulin. And
you don't have to wait till you're sick here, right? And these few hormones that we're discussing, these are just really the tip of the iceberg, right? I mean, there's so many others, and they're all cascaded, and they all interplay.
They do.
And the endocrine system is in charge of this, right? Multiple glands throughout the body. But before going further, let's go through that. Let's walk people through. We like to do that on Wylde on Health. Throw up some slides so that people can actually visualize individualize this at home, starting perhaps with the thyroid. As you were talking about, that was even a personal issue, hits home personally. And people don't have to wait until their thyroids are blasted so far out of proportion.
No.
Their doctors are saying, now you have a thyroid gland issue that deserves drugs or surgery. Here we are with the thyroid gland. Walk us through this.
Well, basically, the thyroid is a butterfly-shaped gland in front of your neck, and it produces a hormone that is the master of your metabolic rate. So your brain sends a signal to the thyroid gland, and your thyroid gland responds by producing a thyroid hormone.
Okay.
And that hormone travels in your body, and then that hormone actually has to get converted to another type of hormone, which is called T3. That's your active thyroid hormone. So unfortunately, look at the pathway there. There's a lot of little places where things can go wrong.
Of course.
From the brain
starting
to the
brain,
thyroid.
The pituitary gland.
That's
We even
right.
have a picture of that for everyone at home. To pituitary gland, down to the thyroid, down to the cells.
Right.
And this whole feedback loop. You know, in your book, you talk about it as sort of a thermometer, right? And you know, and there's the pituitary gland right there for everyone to see.
Right. So that communicates with your thyroid. So if your pituitary gland isn't functioning properly, you could have a deficiency of thyroid hormone. If your thyroid gland isn't working properly, you could have a deficiency of thyroid hormone, which was what my problem was. But sometimes people have borderline symptoms of hypothyroidism, even though their blood tests are normal.
Sure.
And so I think it's very important for people that are listening. They need to understand that the most important value they can ask their doctor for when they're assessing their thyroid function is the TSH, which is thyroid stimulating hormone.
Where should it be?
It should be less than 2 to be optimal.
Okay.
And you can see that your thyroid then produces hormones, and those hormones go into your bloodstream, and then your body responds. Well, if your tissues don't respond to the hormone, there's another potential problem.
Okay.
And so you can use supplements and foods, even natural hormone replacement, to help this whole process.
Let's talk about that. Now, foods. What foods are probably some of the best, some of the top of your list as it relates to helping our hormones balance? I mean, there's numbers of diets individualized, but let's just cover off some of the top, maybe 3 or 4.
Well, I brought examples today, and most of us don't think probably of cheese for hormonal balance.
Yeah.
But
what's this stuff here?
This is high protein cheese.
Okay.
There's actually over 11 grams of protein per serving. And there's hardly any fat, and there's only 1 gram of carbohydrate. Every single time you eat protein, you lower insulin, and you actually help to boost the hormones that counteract fat storage. So one of the best things I think you can do is eat a high-protein snack in the middle of the afternoon. So I brought that to provide a good example, and it's lactose-free. So if you have a problem with lactose, it's a great option for you, and that's available at Loblaws and in most health food stores.
So protein's important. We're just coming on to a break now. So before we do, though, just explain to me, because in your book you do focus on the idea of not to over-focus on one particular macronutrient in your diet, like high protein, low carb, for example.
That's right. My theory is any diet that perpetuates high protein, low carb, low fat is hormonally unstable.
Okay.
It's unsustainable, and the take-home message is this: if you feel hungry or you're having cravings, you're actually not following a diet that's hormonally balanced, and you're going to upset your metabolism. You will not feel hungry, and you'll feel energized, and you won't have any cravings once you start to follow a hormonally balanced nutrition plan.
Excellent. We'll talk about that after the break. We'll also talk about supplementation. And you know what? It's not all about what we put into ourselves. Often it's what we remove. And so when we return, we'll talk about environmental disruptors that can cause hormonal imbalance and identify some that can be found in your home. Scary. In particular, the kitchen and the bathroom. Plus, we'll start taking your calls and emails. Stay right there. For decades, scientists have been studying pollution in land, air, and water. And now they're documenting the industrial chemicals that are building up in our bodies, from newborns to grandparents. Among other things, they're messing with our hormones. And here to explain more is Dr. Natasha Turner, author of the well-known Hormone Diet book. So, before we get right into the chemicals that are hormone disruptors, let's just finish off with some actionable plans, as it relates to diet and supplementation for people out there. Simple stuff. What can they incorporate now in their diet to balance their hormones?
Sure. Well, I think one of the simplest rules is that you can have olive oil every single day.
Okay,
that's
how
one
much
of the
is
rules.
okay?
A tablespoon a day.
Okay.
We know that this lowers insulin, and it actually shrinks the size of your fat cells, and it raises your good cholesterol. So it's following the principles of the Mediterranean diet, because one of the rules of the hormone diet is basically I take 2 nutrition approaches. One is eating for glycemic balance, and that means eating so that your blood sugar is stable.
Right.
And the simple rule is basically eat often, eat protein every time that you eat a combination of healthy fats and carbohydrates, so low glycemic carbohydrates, and to eat regularly throughout the day. So not only regularly, but at the same times daily.
Right, so your body gets used to it.
That's right.
Biorhythms are accommodated for, just like sleeping, right? You mentioned that
That's
as
right.
well. And insulin, let's remind everyone, is a hormone. It's a very powerful hormone, right? We often think, I see a hormone diet, what are we doing to empower our libidos, right?
Right.
But that's just one small fraction.
Well, there's a whole chapter
good,
on
right?
sex.
Just one small fraction of what we're trying to do. It's beyond estrogen, testosterone. So how about these spices you have out in front of you here?
Well, I brought the spices as well because they both lower insulin as well. So this is cinnamon, and we know that incorporating a teaspoon of cinnamon into your diet every day will lower insulin levels within 30 days. And then I brought cayenne for a couple of reasons. We know that adding spices to your meal will lower insulin, but cayenne is wonderful because it also cuts your appetite and it boosts your metabolism.
Without harming the heart.
That's
right.
It's not one of those warmers. And so if you wanted to make a refreshing summer drink, put a pinch of cayenne with some sliced lemon and some ice, and that's a good, simple fluid that you could drink during the day that would boost your metabolism.
Excellent. Toxins to avoid. Toxins in our home, in our kitchens, in our bathrooms where we're putting on ourselves. Just list some that people absolutely should stay away from.
I encourage everyone to go in their washroom right now and to pick up their skincare, their body lotion, their shampoo, and look for the word methylparaben or propylparaben. Any type of paraben will act like estrogen in the body, and it can increase your risk of breast cancer, as well as we know that men that have higher amounts of parabens in their body actually have bigger waistlines. So who knew that the cream you're lathering on every day would actually impact your waistline? But it does. You also want to avoid plastics in the kitchen. So
phthalates.
That's right.
EPA.
So the whole program starts with a kitchen detox. So you go in. If you buy condiments, buy them in plastic. Buy them in bottles.
In glass. Sure.
Store your foods in glass containers.
It's important.
It's a simple thing.
These are, as you mentioned in the book, they're like estrogen mimickers. And certainly, guys certainly don't want excess estrogen, nor do women.
No.
Cancer, precancerous, but these are all causing us to gain weight and get disproportionate
and it's affecting even our babies. We know that you're seeing adverse effects even in adults. Their children who are exposed to this in the womb are having lifelong effects on their hormones in a very negative way.
Right, absolutely. Well, let's go to the phone lines. Let's start with Lisa's calling in from Etobicoke. Hi, Lisa. Welcome to Wylde on Health.
Hi, Dr. Wylde?
Yes, how are you?
Oh, fine. I watch your show often, and I really like it.
Oh, well, thank you.
Yeah, and hi, Dr. Turner?
Hi there.
I have a few questions. I have several problems. First of all, I'm over 300 pounds, and I have diabetes, I have high cholesterol, high blood pressure, and all that, and then now on top of that I have hypo or hyperthyroidism, the one that you lose weight. So my question is, what kind of tests that I can ask for that actually finds out what balance I can start doing right now to help? Because the problem is, no matter what I eat, whether I'm overeating or undereating, I seem to gain weight. So I don't know if it's metabolism or it's because of the PCOS that I have that's adding to the whole thing. Yeah. And every time I also go to my endocrinologist, they don't they don't see it in the hormonal count whether I really actually have PCOS. They just see, okay, she's got a lot of hair, she's gained weight, and they go, okay, she's got PCOS.
Yeah. Okay, Lisa, I'll let Dr. Turner here answer that and give you some advice.
Well, Lisa, you have actually two of the types of hormonal imbalances that I have myself. I also have PCOS as well as hypothyroidism. The most important thing that you can do for your diet is actually start to be very carbohydrate conscious. And probably you may even go through a very brief period of time where you have to completely remove them because you probably have very high levels of insulin, and one of the best ways we can get that down quickly, and which as soon as you lower your insulin levels, it actually starts to help balance all your sex hormones. So your polycystic ovarian symptoms can almost clear up including hair loss on your head, hair growth on your face, or all the places where you really don't want it. And so many people think, oh, I'm going to take a prescription like spironolactone or another type of medication to lower the testosterone, when really the problem in running the whole show in the background is your insulin levels. And so I would want you to be, including the protein selections like some of the examples I brought today, combining with really eliminating your carbohydrates, even if it's just for a very brief period of time.
Okay,